MS Now senior medical analyst Dr. Vin Gupta is here with me along with Philip Bump. Dr. Gupta, tell us more about the work that this panel is supposed to be doing and the void it leaves when they're not doing it.
Absolutely, Ariel. This is the United States Preventive Services Task Force. We don't talk about this a lot historically because there has not been a need to talk about it. It's not controversial. This is a body that puts out when we should be getting our cholesterol screenings, when we should be doing cancer screenings. It's critical because these guidelines then are followed by commercial payers, government payers, to determine what screenings get covered at no cost sharing, what's free for the American public that's ideally has actual durable access to health insurance. And so the fact that we don't have a transparent process anymore, that there isn't separation between scientific advisory boards and decision-making and political decisions, that blurring of the lines, as Dr. Alry pointed out, is going to cause questions about what future decision-making will happen for this committee.
Philip, looking at the gestalt of what RFK Jr. has done so far, how much of this is about following science versus his own agenda? He came into this with an agenda. Everybody knew it.
Yeah, I mean, it's 0% about following science and 100% about his agenda. I mean, fundamentally, RFK's approach here is that the science doesn't tell you. Your gut tells you, your people you're around you tell you. That's who tells you what you should be doing with your health. It is, this has been established even before he joined the administration. His efforts to try and undermine vaccines, even before he became the secretary. This is the approach. And if you have a panel that is dedicated, centered on, here's the scientific evidence, here's what's telling us, ergo we should make these decisions, the thing to which he opposes, the thing that he is most frustrated by, I'm sure, is the fact that they're rooting it in science. They're rooting it in what the doctors say. They're rooting it in the research. That's not what he wants to do, because he understands that if people follow the science and follow the research, they're not going to end in the same place that he does. And that's what he's trying to
to that very point, Dr. Gupta, the CDC's flagship medical journal has refused to publish key research on the COVID vaccine, saying that the updated booster reduced emergency visits and hospitalizations by half. That's sizable. What's the potential impact there?
Well, this is the Morbidity and Mortality Weekly Report. Again, something we have historically not had to talk about, but it's something us clinicians rely on heavily, Ariel. It's rapid deployment of information that might just be sort of hot off the presses that can influence clinical care. And in this case, why are they withholding a report? They have not given credible justification for it. The NIH director says that there's an issue with methodology that he takes exception to, which, by the way, that methodology has been used for decades to determine vaccine effectiveness. So there's nothing credible here to justify why they're doing this.
It seems in many of these cases that methodology keeps coming up. Is there a reason to be dubious about the methodology that our health institutions have used for decades?
No, it's actually it's all the methodologies out there to discuss. I mean, we can go into the nuances of it if we had time. There's no issues with the determining vaccine effectiveness and how we actually determine that from a scientific basis. But it's easy to talk about it, and it's easy to cast aspersions because it's abstract. It's a black box, and it's hard to explain to the public.
I want to get your thoughts before we go on a really critical issue. Our health institutions have historically dispelled misinformation, disinformation when it comes to vaccines. There's been a worrying spike in parents refusing vitamin K shots for newborns. Explain why those shots are important and the deleterious effects if they're not taken.
I'm glad we're talking about this. This is something that now we're seeing more and more across the country. My wife's a pediatrician. She talks about seeing this in her own practice occasionally, where basically parents are now in more and more pockets across the country, about 5% of births, not accepting a vitamin K shot within a few hours after birth of their baby. Why does this matter? Vitamin K is a critical component of allowing babies to clot their blood. We actually have some tips here for parents that might be expectant parents, why it's important. Vitamin K is not a vaccine, just to put it out there. Sometimes there's misinformation, lots of misinformation on social media. Why it's important? Your baby does not, Ariel, produce vitamin K for those first few weeks of life. And again, it's critical clotting to help with the clotting cascade in the body. And often now, sadly, we're seeing these devastating consequences where babies are coming in with bleeding complications in their brain, often dying. And parents, unfortunately, just don't realize that following something on social media for advice on this topic might lead to something catastrophic.